Rob, what are you doing? Still working?
Yeah, that's what I'm looking at. That's why before I'm sitting out here and I got all these papers. Crap. I quit looking at that stuff.
Did you already have software figured out, Rob? Maybe I shouldn't have asked,
yes
right?
And no. Yes and no, I guess. Yeah.
Technology can be your best friend or your worst enemy, I'll tell you that.
Yeah, by the time I think I get the hang of it, it doesn't work out so well. Always freezes up or you're right in the middle of something.
Yeah, well, I understand.
So I was in doing payroll this morning. Got it all entered. Probably took me 45 minutes to get it entered, and everything. Got to the last person. The lights flickered, knocked it all out. It didn't save or nothing. I had to start all over again.
How often does that happen?
Not very often.
Okay.
But it happened first this morning when I was trying to get stuff done. Before noon, especially.
That's not good. All right, guys, it's 5:05. 7:05, and I'm going to go ahead and start the session. So, as you guys all know, I am not Dr. Michael Breyer-Ash. I am David Tam, Economic Development Coordinator, and I am the moderator for these meetings and sessions today. Today we'll be talking about COVID-19. Hopefully we'll be able to get Dr. Breyer-Ash to join us a little later. I am not anticipating that to be sure, but myself and Robbie Craig and Tony Fee will be able to assist us the best that they can with whatever answers we have. And if we can't answer those questions, we will definitely encourage you to reach out to Mr. Breyer-Ash himself if we can answer that, or feel free to direct any questions to us if you would like. So, as we all know, COVID-19 is a popular topic, and so is the White Cloud Health Clinic. And Dr. Breyer-Ash did provide us a pre-recorded session with some information and data to share, which I will be sharing with all of you today. And then after that, we'll talk a little more about COVID-19, and then we'll open up for Q&A. If there are any topics we'd like to discuss, feel free to do so. And in the meantime, please mute your mics, and I'll play. Before I play the video, are there any questions before I start the video from Dr. Breyer-Ash?
No.
No? Okay.
David, do you know how long it is? That way they know what to expect for.
It's a 20-minute video, Tony. Thank you for asking that question. By the way, that's a good question. It's a 20-minute video. To let everybody know, that'll be the update from Dr. Breyer directly. One second. It's not allowing me to screen share for some reason. Okay. Can you guys all see the screen?
We can now, yes.
Thank you. Okay.
You have been our medical director since February of 2020. Tell us a bit about yourself and how you came to be here.
Well, thank you. Yes, I have been here since February of 2020, and I'm wearing a mask to show that I take the COVID social distancing and practices very seriously, but I'm going to remove it just so that those of you who don't know my face or haven't met me will, when we can finally remove these things, hopefully in the not too distant future. So, but I'm going to put it back on again now, because it's important for us to do that. And yes, I came here prior to coming here as medical director. I did know White Cloud Health Center, and some of you will know me in the community, and I know the staff did, because I was what they call an area diabetes consultant for the Indian Health Service based out of the area office in Oklahoma City for 8.5 years. And during that time, I would come here every few weeks and see patients, and some of you may have seen me. And I left in middle of 2018 to go back into academia I went to the University of Arizona, but I was invited to be on the health board of the newly independent White Cloud Health Center, and I was delighted to accept that honor. And then it became clear a few months later that you were looking for a medical director, and I was also delighted to take up that position, as I have a lot of affection for the community and for White Cloud Health Center, and know many of the staff and several of the patients, and I was happy to do that, and I'm very happy to be here. So that's as much as you want to know about me, I think. Let's move to some of the interesting questions I'm sure you have.
Sure, thank you. The main thing that is on all of our minds right now is COVID-19. What can you tell us about how White Cloud Health Center is addressing this?
Well, of course, now we're almost a year into this, what turned out to be a pandemic, and I have to say that I think we and the health board took it very seriously early on, and I think that some of the things I'll tell you a little bit later on will support that, because our rates of positive testing and infection in our community have remained low, and much lower than in the states in which we're located and that surround us, which is a good sign. But we early on obviously endorsed and made a policy of social distancing, masking, and frequent hand sanitizing, and all of those things for our staff. And when you come into the health center, you will know that you are asked questions, and we continue to do that to this day, and that everybody that you will encounter there is like me at this time, wearing a mask, and if we suspect or are concerned that any of our patients may have COVID, we provide care and we do testing, and we do it in a way that protects everybody else. We continue to offer general care services that we always have, but providing care and testing to those patients who might be suspected of having COVID without endangering the rest of the community and our other patients. And I hope that those of you who've come to the clinic have experienced that and feel that we take this very seriously. So perhaps in a little while we'll talk more about what we're doing in terms of testing and vaccination, but I hope you feel that we have been there for you during this pandemic, and if you have any questions, I hope that you will not hesitate to direct them to our public health nurse, whom again many of you know, and tries to be, and I think is very accessible to you as community if you have access to the website. But on our website, her number and extension are posted, and if not, you can just call the clinic and we'll put you through, and I know she'll get back to you promptly. And you're also at any time welcome to call me for any reason, any concerns you have. So
Thank you for that. Can you please tell us about the testing?
Yes, so we started testing as what we call reference lab testing became available, which is where we would obtain a test, and you know that the standard way of doing the test is, I've heard it called a brain scrape, but it's really not quite that bad. Sometimes they do, as many of you who by now will have undergone a test, it's twirled around your nose, sometimes in the front and sometimes in the back, and generally both sides. But the importance is to get a thorough sample, because how your test result comes out does depend on doing the technique properly. So if any of you have experienced that as discomfort, we apologize, but it's because we were trying to be thorough. But we've been offering that type of testing, which is sent out to our reference lab, since very early on, back in February and March. And the pace of testing has built up. Now, we didn't offer early on what we call point of care testing, which is where you use a machine in the clinic itself, because we're a relatively small clinic, and because we had a concern about the possibility of false negatives when the technologies were newly being released. And so we held back on that and offered the regional reference laboratory testing, knowing that it was what we would call the gold standard, that we could really believe and trust in it. And that was not because we were, I think, lazy, or not because we were not willing to. In fact, we were offered platforms to test for free, but we wanted to follow the policy of safety first, and I hope that we have succeeded in that. Now, more recently, there has become a need for testing for people other than those who have clear-cut symptoms that should be suggestive of COVID-19, and examples are people who are going to have operations or procedures where the hospital or the specialist says we want a negative COVID test done in a certain amount of time. And then we felt late last year that we should start introducing routine staff testing at the beginning of every week. I think that it's helpful that you know as the community that all the people that are in the clinic are tested weekly to make sure that we are safe to be interacting with you, because of course we are at a higher risk of exposure. Do not actually need care at the time when they're seen. When they come in for a COVID test, they need a COVID test, but they're not asking to be taken care of, and so we will do some of the testing outside, as some of you may have experienced in your vehicle, rather than bring you into the clinic, because that means we have to isolate you and clean the room afterwards. And so we've been doing some testing in what we call low acuity, meaning we have a low index of suspicion or low level of suspicion that you actually have COVID, but still feel it's advisable to do testing. So we have moved ahead, and we're now using a point of care, what we call a point of care test, meaning you get the result in the place where it's done and don't have to send it away. And we're now using that in certain circumstances, and sometimes we will do both. And I think that on this talk, it would be be a little bit of overdoing it to discuss all the details that go into that decision making. They're not secret, and we're willing to explain them at any time, but we are doing regular testing. Now, one of the things I should say is that our testing rates, positive rates, have remained low. Now, initially, for the first several weeks of the pandemic, we didn't have any positive results, and like everywhere else, that has changed. But we're still at a rate that's about 6 to 7% of our tests are coming back positive, and whereas for Kansas most recently, I believe last month was about 17 to 18%, and some places, some locations are up, that their current tests are coming back about 20+% positive. So good thing is that I think due to early adoption of health measures and sensible behavior by you, our community members, we have kept our percentage in positive rates low, and I'm very proud of you all for that, and to some extent proud of us too.
Thank you. With the new vaccine being rolled out, can you tell us how that is being handled at White Cloud Health Center?
Right, well, that's a very good question, and one I'm, of course, eager to answer, because I know that there are some folks who are a little concerned and reluctant to take the vaccine, and there are some who are very eager to get it, and of course I would naturally be supportive of those who are eager to get it, because I think it's a very important measure, and I think all the data that we have seen is that by and large it's extremely safe and effective, and I would take this opportunity to encourage those of you who are on the fence to, and maybe you're not going to be one of the first people to come in and say, yes, add me to your vaccination list, but if you give it further thought and try to keep an open mind to the benefits, I think far outweighing the risks from what we know at the moment, that the benefits to you and those around you, including other members of perhaps your own families, are in favor of getting vaccinated. And there are obvious exceptions to that, but we make sure that we are not going to vaccinate anybody who we think is likely to be at high risk of any sort of adverse problem as a result of it. So we have received our initial dosages of vaccine, and that they started to arrive, I think, just a couple of days, 2 or 3 days before Christmas, actually. And we elected not to vaccinate people. We would have had to vaccinate the very day it arrived, because Christmas Eve and Christmas Day, we were not open. So we, rather than rush things and not prepare properly, we decided to start the process the following week, which was last week. And we're following the priorities that the federal government and an organization, or at least a branch of the CDC, or the Centers of Disease Control, called ACIP, which is a council that advises and sets the guidelines on how these vaccines should be used. They published, and so we have put a simplified version of the initial steps of that on our website, and I believe they will also be going, if they're not already, on the tribe's website, and we'll be getting that word out to you all in various different ways. Now, will we ever be able to reach everybody? Nothing is 100%, but we're going to do our best. I know that some of you do not, and I suppose you would be ones who are not actually seeing this broadcast, but do not use the internet or are online very much. So we're going to be doing other measures to try to inform you, whether it's by including notifications in prescriptions, by using media and asking people to let you know, your families and friends, verbally. We're going to be trying by all means, and including the major tribal entities, and I don't need to list them for you, but the leadership there will be posting and communicating with members and participants, and we're going to do our very best to make sure that everybody's informed. Now, I think it is worthwhile just briefly mentioning how at the moment our approach is structured. So according to the guidelines issued by the federal government who approved the vaccines, we should vaccinate healthcare personnel, and that includes those personnel in healthcare facilities, even if they're not doctors or nurses, but who are exposed and around patients first, and also persons who are deemed essential workers. And we have done that, and the next stage is persons over the age of 75, and also those who are considered essential workers. Now, there is a published list of what the federal government includes, or the CDC includes, as essential workers, but as an autonomous nation and tribal entity, we at the Health Care Center feel that this should be set by tribal council, that we shouldn't be telling tribal communities and tribal entities who is essential and who's not. That should be a decision for tribal government to make. And so that is why on our posting on our website we've said, please contact if you work for the tribal entity, please contact your supervisors, and they will direct you based on what the tribal leadership and council have told them. And so I'm not going to name any obvious essential workers on this broadcast, because I think that would be inappropriate. You will, if you know the CDC guidelines, you'll know that many of them apply to tribal entities, but others are an area where tribal leadership will be making that decision and communicating it to all entity managers, directors. And then after that, we will be looking at slightly younger age group, 65 to 74, especially those who have conditions that put them at greater risk for having a bad outcome if they were to get infected with COVID-19. Now, we think that we are sure that we will have adequate vaccine and there are further tiers or levels, but I'm not going to go down and read them off. But suffice to say that we believe that we have and will have in the very near future sufficient vaccine to make the vaccine widely available to community members. And so any of you who are concerned about not perhaps being on an early tier, I can assure you that you will most likely not have very long to wait. We are vaccinating this week and next week, and we're going to continue to do that. Now, one of the things I want to mention is that there is a second dose that needs to be given and the type of vaccine that we have, it needs to be given at 28 days after the first dose. There is slight flexibility with that, around that, but to allow in case of urgent emergencies that you couldn't make it in. But you do need to consider if you make an appointment for your initial vaccine, that you will be available 28 days later to have the booster dose, or you might not get the benefits of it. So, and we are choosing to follow, although you probably heard in the news that some countries have said, well, let's give everybody one dose and then give them a second dose if we can. But the CDC and the Department of Health here has recommended that we follow the protocol of immunizing and giving both doses, and and make sure that everybody as much as possible gets both doses at the right time. So that's what we're going to follow until other recommendations come down. Now, the one last thing I want to say is that we invite you to contact us and put yourself on a list. And it doesn't matter whether you're concerned that you'll be a low priority or a high one. Please contact us, and we are keeping a list, and we'll put you in the correct priority so that nobody is favored, nobody is treated unduly, unfairly, and nobody is favored in a way because of any kind of contacts or relatives that they might know. We're going to do our very best to treat everybody exactly fairly according to their needs and their priority for health reasons.
Thank you very much, Dr. Brower-Ash.
Well, it was a pleasure to talk to you, and again, please feel free to contact me anytime, and I look forward to other opportunities to talk to you more about some of the other things and progress and advances that we're making at the White Cloud Health Center for you. Bye-bye now.
All right, that was the conclusion of Dr. Brower-Ash's video. And of course, as you mentioned before, feel free
David,
to
you're
talk
on
to him.
mute.
Thanks, Tony. Thanks, Tony. I was just saying that concludes the Dr. Brower-Ash's video, and as he said in his video, please feel free to reach out to him with any other main questions or comments. To add a little more context to that, I just want to share a few numbers from the county's sites for cases as of today. There are 1,058 cases for Brown County. There are 746 for Donovan County, and there's 526 for Richardson County. So those are the most current cases status as of today regarding COVID in your area. And it seems that overall the feedback has seemed to be that the Iowa tribe has continued its mask mandate. Masks are required for all areas of the Iowa Tribe Kansas-Nebraska Reservation. That has not changed, even though counties have changed. And I believe that those rules will still stay in place until further notice. So please be sure that you're aware of that. There's also another question that came out to us before this call was about mask. What's a proper mask? I would recommend researching the CDC's website, but anything with 2 layers or more would be preferable. Neck gaiters are not recommended, nor are bandanas in regard to that. So please make sure you just wear the proper mask, and if you do need some mask and you don't have any mask, let us know about that, and we'd be happy to support that effort. I have masks that we can provide if we need to. With that said, would the Executive Council like to have anything else to add to that, or should we open up for a Q&A?
I don't have anything to add.
Yeah, I don't either, David. You can open it up.
You have any questions or comments, and please make sure you're unmuted.
This is Rebecca Jones. Has the priority list been publicized anywhere or circulated to the tribal staff?
Rebecca,
Who's on the priority list?
yeah, unfortunately, I don't have the answers to that. I think Dr. Brash may, but Robbie, do you have comments on that?
Yeah, I think they're supposed to have it on their on their White Cloud Health Center website, Rebecca. I believe it's posted on there. And we're in the works now of getting it to where we can distribute, in our senior meals, along with they're going to distribute within the prescription, any prescriptions that are going out of the clinic. You mentioned that, I believe. So we're also going to post it once we get the posting. We're going to post it in Grandview and on all the office buildings on either the windows, on the front doors or something, so everybody can see it from that standpoint. Also, Brad will also get you a copy of that housing too, so you can post it somewhere over there for folks that live in the apartment complex.
What about the vaccinations for essential staff? And that's a continuity of government thing to make sure that our government leaders, our law enforcement, those types of folks are vaccinated early.
I think what we've kind of decided here, Rebecca, I know the law enforcement, they've been contacted with the vaccinations. Like you said, they're going to start vaccinating tomorrow. I know I got a call from my mom, and she fits within one of those high-range age groups, and she's going to be vaccinated tomorrow. But our law enforcement, the ones that some chose not to be and didn't want it, those that chose, to get the vaccine, I believe are getting it tomorrow. The executive committee, the ones that fall within them upper ranges, age groups, the early age groups. I think the other ones, at least I've said I want the elders and the others that. So that's kind of where we're standing as far as that. Our meal site folks that fix the meals for the seniors, they've also, as far as I know, been contacted. They're going to be also vaccinated. So.
Thanks for that response, Robbie. Mr. Fee.
Yeah, what about frontline workers that don't work on the res?
I'm not sure.
Yeah, that's a good question, Martin. I assume you're talking maybe frontline workers that are tribal members with off the reservation. Is that what you're asking about?
Well, I'm talking about, they live on the reservation, they work off the reservation, like in a nursing home or something like that.
Yeah, I would contact the clinic. I don't know. The part I have a hard time understanding is how they prove, where they work and what they're doing. But I would contact the clinic with those questions. I don't have those answers. I would assume if they're an essential worker and they're, I would assume they would be, would fall within that realm of being vaccinated. But that would be a question for the clinic itself.
Well, I'm not sure they want it, but the point, I guess, is they're frontline workers. That's been kind of determined nationwide almost. People that are in nursing homes taking care of the elderly are higher.
I think some of those too, Martin, maybe already. I don't know this, but if they're coming to them nursing homes, the states might be going in and giving the vaccination to those frontline workers within their own facility. But I don't know the answer to that either.
Well, I don't know the answer. I was hopeful of that too. Yeah, I was just asking from the tribe's perspective.
Sure.
I'm hoping the state takes care of them wherever they work. Okay, thanks.
Yep.
I will also let you know that based on some other conversations I've had with other people who are in that industry, the nursing homes are required to provide that vaccination for them. And that also goes same for the people in the medical field. My wife is, for example, a medical fraud investigator. She's not considered high risk, so she deferred hers to frontline, but the hospitals and service providers and nursing home providers are the first and foremost people to get a vaccination being sponsored either by the employer or by the county or city at that level. I can't speak for the particular county that you're referencing, Mr. Fee, but I'm assuming that they would have very similar protocols. Any other questions? Maybe I have a question for the audience then. Does everyone feel like they have adequate mask supplies, and do they feel that, I guess first of all, does everyone have adequate supplies of what they need in regards to COVID at this point in time? Is there a shortage of anything that's out there or a different need that we're not aware of?
hear me?
Yeah, we can, sir.
Okay. Does the station or anything offer any hand sanitizers or anything in that regard?
Are you talking for sale?
For sale at Grandview.
Yeah. I don't know that question right offhand, Martin. I don't know if they have anything like that up there for sale or not. I know the tribe supplies the station, so there's sanitizer there for customers to use while they're within the facility, but I don't know if they have any on the shelves to sell. I don't know that.
Okay, now back to his statement. Availability of masks and stuff. I mean, I don't quite. There's probably a need for masks, but I didn't quite understand your comment. Are they going to be made available at some point, or available now if you ask for them at the clinic, or you're just on your own?
Well, I think I'm more or less asking because if there's a need for them, that if people don't have access to them, that's something that we can discuss about trying to provide to the level of people who are in need. But it seems that many people, it depends, because some areas have people who have plenty of access to it, and some people want more access to certain supplies. So I guess my whole point is that, and I would have to explore this further, is I just want to make sure that everybody felt like they had proper masking to feel like they were protected. And if there was ever someone that was in need of a mask that were not available, then please let me know. Because I actually personally have masks that I'd be more than happy to willing to mail out to anyone that was there that wanted a mask, or the tribe could provide it if they had access to them. And I cannot speak to those terms at this point in time, but I personally will help supply a mask myself if there was an issue.
Okay.
In regards to hand sanitizer, if there is not any available at Grandview, that we will make sure that is available at Grandview in the very near future.
I guess it's not clear which is a proper sanitizer. But I guess most of them have to be 70% alcohol, correct?
That is correct, my
I know
understanding.
there's a lot of products out there is not 70%. And the other thing that's a shortage when I go to the grocery store is Lysol. The disinfectant that you need to clean everything. It's about non-existent. More often than not. I don't know. The hand wipes and those types of things, every time I go to the store, they're out. I just haven't bought any for ages. So I'm just relying on, bottles of hand sanitizer whenever I can find one I think is appropriate. So that's just kind of my question. I don't know if the gas station can get some of that stuff or make it available to purchase at Grandview, or, I just don't know that I see appropriate stuff in there. And that's about our only marketplace, locally. Okay, thanks.
Yeah, I would thank you for that input, that feedback, and just to let you know that as being the Grandview store is being under review, so we will make sure that we have the proper equipment in there in the very near future, Mr. Fee.
I know that many tribes have used their CARES money to do kits, particularly for elders and the students, people or children that were enrolled in the tribal Head Start, or going to their students that were getting ready to go back to school and stuff like that. Then they sent home a kit with them. Here's you some, 5 masks because you're getting ready to go to in-person school. So here's 5 masks. Here's some laundry detergent so you can wash them. Here's some, and have those cleaning kits available to them so that they are able to be out and about and try to stay healthy without paying double the cost at Grandview or something like that for those essential supplies. I think that was the intent of the CARES money when it went out.
Rebecca, you're correct, it is, and that also a lot of CARES funding was used for that purpose early on, and it's been continued being used for that purpose as well, because we do have an allocation for that purpose, and so that's something that is being further reviewed and discussed as we speak. And also, we also allocate some of those fundings also for the testing as well. So that funding is being used for those purposes, and will continue to be used for those purposes. So I do like the idea of the kits for the kids, but I do also believe that we'll be looking at some other solutions for the entire community as well. But good feedback on that too. I've written that note down, and I'll make sure we incorporate that to our next discussion too. But I do believe that was already on our list. I'll further that kind of conversation and get back to you on that, Rebecca.
there were several programs that handed out masks. JOM for one handed out stuff for the the kids, and I think Native American Family Services or the one of the other programs is Auburn or handing out to their clients like laundry soap and that type of stuff also.
Thanks, Tony. I think Claudia has a question. Or Miss Bachman has a question. I apologize.
No, I don't. I messed up my phone.
Not a problem. Are there questions, comments, of input? And maybe Tony, maybe we could follow up and see if there's another round of stuff to give on to those programs if necessary, and find out what they're doing, because I'm not 100% sure myself. We can discuss that in our next call.
Yeah, I mean, we could do that.
Are there any other kind of questions at all?
I would just like to say, I would encourage you all to reach out, share this with everybody, let everybody know, because our numbers are falling weekly, and however you need to share it, whatever we can do to get it out there, to get more people involved and more people listening and more input.
Yeah, I would agree. Our whole goal here is I'm sorry, go ahead.
I have been sharing it. I think a lot of people are probably a little bit distracted right now with what's going on in D.C. for tonight, anyway. But I have been sharing it, and I have been encouraging. I do hope that a lot of my family lives on the West Coast. They live in Oregon, and so 5 o'clock is a little bit. They're getting off of work and getting home and getting their kids settled and stuff like that. They haven't been able to join the meeting, so but they have expressed interest and are looking forward to being able to watch the videos on the website.
That's great to hear. Thank you for that, Mr. Jones. Appreciate that. Yeah, I mean, this is something that I know membership has asked for, is better communication, and we're here sharing this information. So we just want to make sure that people know that we're sharing information, that we're trying to get as much of this out to everybody, to the membership, and we would love to have some further participation. Mr. Fee.
Yeah, I got another question. You hear a lot of rhetoric about assistance for people that with job displacement, or they had unusual expenses at home because the kids were home. And the benefits that they're relying on, at least the ones on the reservation, there's, I guess, been unemployment and things like that. We don't have anything to give them a boost outside of that, like the groceries or anything that could give them, other than the normal support. You follow me? On our grocery program, whoever you're low income or whatever you can't qualify for. But I guess my question is, again, I think my best example was with two head of households that were out of work because of COVID, had long time employment, and then their kids were home because they were sent home from school for a short period of time, and maybe some of them had to do some distance learning, and they may or may not have had adequate equipment. So I don't know if there's anything we could have reached out to those people to help them with or not.
I can probably address some of that, but I think I may ask Robbie to address some of that as well. From an educational standpoint, from a resource standpoint, there are many, many resources out there and programs that are set up for schooling. So, for example, if they needed some hardware or internet access, the school as well as internet providers are providing these services and equipment free of charge or at a drastically discounted. But I think mostly it's been free because most of it's been supported by government to do those efforts. And I believe that there are various programs within the reservation that are designed to help support that. And as far as what's going out and how it's being distributed out to them, I can't go into detail on that. As far as I know at this point, Robbie, you want to add more to that?
Yeah, I think the only things I know of would be like our organizations here, that we have, I know the Boys and Girls Club, will put the meal baskets together at Christmas time, for the seniors and the club kids. We've also we're in the process of, we're going to start up the meals like we did again this summer, for whether it's a sandwich or something, a bag of chips, something to hand out along with senior meals, so they have another, another meal along that goes out with their senior meals like we did this summer. Things like that. But as far as the internet, the things like that, that would be more of a Native American Family Services, Martin. I don't think the tribe itself did anything, and I don't know about, like the local telephone companies or internet suppliers either.
Rob, we did set some money aside to go to Shelley for, to help out with certain things up to a certain dollar amount for, pretty much anything, I think, if the request was sent in to Shelley up at NAPS.
That's correct. Yeah,
but that's just for people in the service area, right? So Brown, Donovan, and Richardson County. It's not for our membership, like our college students that may be in Lincoln or Omaha or Lawrence that are having to do school online.
And that's true. It is just service area, Rebecca.
I also will add to that, from being from a college town too, that the universities and the schools are also providing services to support the students as well, as many of them could not return home due to COVID or travel restrictions and so forth. So again, there are resources within their community as well. So as far as, but you bring up a very good point, Mr. Jones, about resources going beyond the community, how that applies. And I think that's something that, if we were to further explore that, which I think it's not a bad idea, that would have to be gone through legal to ensure that it was done properly if we were to go down that route. But I do know that the restrictions on there, in some ways, unfairly applied to tribes, in my opinion. Mr. Fee, did you have a question?
Yeah, I guess I just need clarification, because I don't know if I got it on a couple of conferences a while ago. We got money from the federal government or wherever, probably because of COVID-related situations. The way I always thought I understood it. And I thought that was the outreach to our people, a lot of it. I don't know. I don't know what... I wasn't in on that. I don't know how much money we got. I don't know if it was based on our total population members or just our reservation members. I think it's a little disheartening or not very good to say, well, we've got 4,000 members and government gives us money based on that and we spend it on 250. I don't know. I'm just asking, because I don't know anything about that. I just know how to read. Some places, you get this money, and I don't even know where it comes from. And I'm just curious how that all was determined, because I don't know. I'm just curious.
So can I break your question down to a couple of parts? I think part one of your question is how was the funds allocated to the tribe? Is that part one?
Yeah, I'd say that's a good start.
Okay. Rob, do you want to tackle that question, or would you like me to address that question?
Well, I don't. Yeah, I should have brought the folder home with me. I know there were several things. The money came from the United States Treasury, Martin, is where the money came from, and it was part of the CARES Act. And the tribe had to turn around, and we had to submit population numbers, HUD numbers, how many people lived on the road. There were several things numbers we had to submit to Treasury, and then Treasury came up with some kind of formula, and that's how it came to what the tribe got as far as funding goes.
Okay, then the Treasury would probably base that on, did they base it on thousands of people or 200 people? It seems to me the numbers would indicate they base it on a significant number of people rather than a small number. No? Okay.
Yeah, they have their own formulation, and we don't really know what that formulation comes down to. We provided the data that they requested, and they came up with their own formulation. There are some people, tribes that are disputing that number, but that's how it was sent down to the Iowa tribe.
Okay, how much money did we get total from that?
I believe it was 2.3, Mr. Fee, and I think I shared that number, 2.3 million. That number was shared in our CARES discussion as well. And
okay, I just want to confirm that's what that was. That's what I was asking.
yes, sir. That is the total amount that was provided through that. And then again, in our discussion, the monies were to be applied for infrastructure and to help the community purposes. So following our legal counsel, it was applied based on legal counsel's appropriate use.
Well, I think I'm pretty accurate in saying that we didn't get that money on 300 people, 200 people, 300 people, whatever lives in Donovan, Brown, and Richland County. I don't think they'd give us 2.3 million for that handful of people. So my point is, it's a little disheartening or a little discouraging that we always have these forgotten people. And some of them have the same struggles these folks on the res have. And, I know you guys keep preaching we want to include all these people and all these conferences, all these meetings, yet they've been blocked out of the system for, 20 years. Yet we want to take advantage on the resources the government gives us based on those numbers. I'm confident it couldn't have been based on 300 people or so. I'm convinced it was based on a greater number if they give you $2.3 million. So that's just my concern. I just always get frustrated with that. And then when the people don't play a role, then you wonder why they don't log in on these meetings. I mean, why would you? Why would I waste my time? I mean, I'm not included. My voice doesn't mean nothing. It seems like all the resources are always used in those 3 counties or 4 counties, maybe use the Missouri one. But I don't know. I'm just talking because I got a different philosophy probably than most. Like Louise Tim said, and I think you guys all shook your heads there, that this tribe is about all the people. That's why we're here, and that's why we get what we get. That's why we're doing this. But then again, I'm not sure that's what we're doing. So, I thought this was more of an example of what we're not doing for our reservation, or on our whole people as a whole. It looks like we're just concentrating on the immediate few. And because I know most of those people that got educated, moved away, had locked off to this tribe, are not going to come back. And, it sounds like we were going to look for people to come back to do this or do that or participate in this and that. So we may be fooling ourselves a little bit. But I don't know. I mean, I'm only one person. And I have my own opinion. That's why I'm sharing it. So, I mean, that's my frustration. And I've always shared that. It's kind of like, I'll tell you this little story. You guys don't remember this. I don't think any of you could. It's like when we got our settlement years ago. To come up to vote, do we want the money or do we want the land? Well, they voted for the money. What'd they get? Maybe $1,600 a piece. That's all. That's all they got. We could have land instead of money. Now we spent all our resources last few years trying to secure land that we lost years ago. I know we're probably fortunate we have a casino and stuff to do that. But I'm kind of ranting raving. I'll be quiet, but that's just my opinion. So I got a different direction I like to see us go. I've talked about things too. Everybody always said, file the land on the reservation back. Well, I think we can make better investments off this reservation. We don't have to buy everything on this reservation. It's just one of those things I think we're misguided sometimes. But that's just my opinion. I'll be quiet. I'm off the subject, really, but it's okay.
Mr. Fee, I would like to first say you always have a voice. And I think that your voice is an important voice as a member of this community. And you have a lot of history with this as well. So I just want to let you know that I do appreciate your input and your feedback. I also would like to continue to say that, this COVID situation, the care situation is unique. We weren't anticipating this. This wasn't part of the plan. This just kind of happened, kind of surprise. And we're actually really just following the protocol based on the U.S. government. I don't disagree with you that expansion beyond the reservation is a good idea. I think it's a great idea, but I also think it's important that we don't forget the people who do live on the reservation as well. And I think that there's a way to help add value to everybody, who are on the reservation and off the reservation, but it also takes time. And I think that, the COVID funding itself is designated with a purpose. It was designated to prepare, prevent, and respond to COVID-19 for that community and for the members. So with that said, again, following legal counsel and the Treasury requirements, it's intended to support your community that the Iowa tribe, they all live in, which is why that the projects were structured the way they were structured. I am hopeful that people will be proud of their community and want to come home and help it grow there and branch out as well. It can be done, but it's going to take some work. And I think that you have a lot of good insight and a lot of good feedback that I would love to have a further conversation with you, directly about your opinions of what can be done. So I hope that we can not just serve the people that live there, but also beyond as well. Mrs. Jones, you have a question?
I think when we're talking about community, I think that was part of the conversation and part of the argument that tribes had when they went and asked for this money and were awarded the most money ever from the Treasury for this purpose. We get to define who our community is, and it's not just people that live in a certain area or county. We define who our community is. And so if we say our community is all of our tribal members living nationwide, that's part of the argument. That's why there are lawsuits going right now about how they determined what money they were going to give to us.
Yep.
This little measly amount. And I do think that the 2 point whatever million dollars, that was just based on the tribal members that live in the immediate service area. That's why there are a lot of tribes that have lawsuits going right now. But I do think that we should be a part of those lawsuits because we get to say who our community is.
Robbie?
Yeah, Rebecca, to respond to that, we just got word that today, just realized that I think Prairie Band has filed a lawsuit. And so there was an email sent to the executive committee this afternoon, and I think there's going to be a discussion maybe trying to follow in their footsteps and going on that same path.
I think that's a good idea. We absolutely should. We have members, the majority of our membership do not live in the 3-county area, and they have needs that are not being met. We can't afford to lose one member to this disease.
Yeah, absolutely. I think we all agree with you 100% on that as well. And Robbie, thanks for sharing that because I know that you saw that email as well. So that is coming up very, very soon. And I think to address everybody's concern here, Mr. Fee's concern as well as yours, Mr. Jones, that we do understand that, we want to abide by that. We're just trying to be very diligent and abide by the structure that's been set up by the Treasury and by what legal counsel has been advising us on this funding to make sure that it's being used appropriately. We do understand that it needs to be beyond what it is now, and we're hoping to be working on that. I apologize we don't have all the answers to that today, but again, we're all trying to work through that together as well, so bear with us as we do that. Are there any other comments or questions? Mr. Fee?
Oh, can we add Imagination Library to next time's topic?
Could you delve into that further for me, sir? What do you mean by that?
I said I'd like to add Imagination Library to our next week's topic.
What does that mean, sir? Can you explain that more for me?
Oh, okay. Yeah, I'm sure you're probably not familiar. The tribe, a few years back, I encouraged them to sign up for Imagination Library. It's kind of a Book of the Month club initiated by Dolly Park years ago. And it's when you're born, you get a book until you turn 6 years old. You get 60 books. Book of the Month club. The cost to the tribe at the time was about, I don't know, it was about $250 a book. I don't know what it was. It's about $250 a book. So it was only so many dollars a year. So I thought it was a good investment to invest in our children. So I encourage the tribe, I don't know how long, it probably took me a year and a half, 2 years, to encourage you to participate. And I've worked with Tony and Rob a little bit here lately talking about it, and they've got some good ideas. But I'd like to see us make sure we meet a good goal on that. You know, I think we heard once we might have signed up 60 people a year in our enrollment. Rob thought maybe a little more than that. And I don't know how many of them kids are between 0 and 60 months of age. I'm assuming most kids are signed up when they're young. I don't know how many adults sign up or enroll. So, you know, one time we were reluctant to include them, the children, until they were enrolled. And that frustrated me a little bit because if their parents are member, what difference does it make? You know, if the kid gets enrolled later, we'll get them enrolled, and, you know, that might be a starting point to get them enrolled. So I thought, so Tony suggested we send them the application for Imagination Library with an enrollment. That way they're aware that they can apply for this. It's online, but, you know, most people don't follow us. You know, I figure we need to talk to the head of households. You know, I don't care if it's grandpa, great-grandpa, great-grandma, and kind of work our way down the chain and find out where our children are. And try to get these books in their hands. It's just my opinion. I mean, I think it's a low-cost program. I think last time I looked, we have 19 kids participating. And, you know, we got 4,000 some members. You know, you can do the math. We got quite a few kids in that category somewhere. And some of them may not be very fortunate, you know. I support the program completely. You know, I get the books wherever I can get them. You can sometimes get them at we call it the thrift stores, because what happens is they sometimes have return books, and they don't actually return them because you don't pay the postage for a return. You have to pick them off at the post office. You know, if you send them to Falls City and nobody picks it up, you pick it up in a month or two. You get the book back, but you got to go to the post office to get it. So I think I think we just need to try to get the word out, because I know some people had a little struggles. You know, that's why I got a little concerned a while back in getting their kids enrolled. I know it was getting birth certificates and all these different things. So we kind of got over that hurdle, I believe. But I'd like to see us take another step, because one time I think we had almost 40 kids enrolled. And like I said, it's been going down every month. Last time I looked, it's 19. So I think our population of children doesn't go down that much, that we kind of at least maintain in that age group. So we need to kind of see what we can do. That's just my thoughts.
Thank you, Mr. Fee, for educating me on what that program is about, and I will definitely take a look at that more. As far as getting on our next schedule of events, I'd look at the schedule and see if we have time that permits. We do have a set schedule, but again, I'm more than happy to reach out to you, and then we can also add it to our agenda for future discussions, or hopefully maybe pivot some stuff around. So I would love to work with you on that a little more, understand that more, and I will definitely get back to you a little more. Any other questions or comments about that? Rob, you want to talk more about that at all, or anything else?
No, I think it's a great program, Martin. It's just a matter of, you know, there again, getting information, and I think Tony's probably got it right here with sending the paperwork out when they call and ask for enrollment papers. You know, at least for the newborns, that doesn't, you know, fix the problem with the kids that we have that are, you know, 3 and 4 years old now that are out there that maybe didn't get enrolled at the time. But yeah, I think it's a great program. I support it. I just don't know the right answer of how and to connect, you know. And then the other thing is, you know, some families may get the papers and pitch them in the trash. You know, I don't know. But I'm in support, and I'll, you know, I think we'll work with whatever we can to get the word out and try to make this program successful.
As I mentioned before, if there's any way I can help, I'm willing to help. You follow me? I mean, I'm sold on this program, and I want to impress the tribe to do it. And there's access everywhere. It's like we have it on our website, I think, something about the application, the contact. I mean, the contact person needs to be updated because it's a different person now. And we also, if Tony sends it with enrollment papers, that's another way. It's on Dolly Parton's website, the application. It's a one-page application. You just about got to tell name, birth date, and parents sign it. I mean, it's about that simple. It's it's real convenient. It's not, like I said, not difficult. But I know we're missing a lot of kids, and it just frustrates me, and I think we are. You know, I can't guarantee we are. But with our numbers, I'm sure we're missing people. You know, that's enough said.
Mr. Fee,
Topic for another day.
Mr. Fee, if you'd like to reach out to me, I'd love to help support on that as well, and see how I can work with you on that as well. My email is dtam@iowas.org, or you can ask for Robbie for my contact information as well, and I'll be happy to help facilitate and work with you on establishing something like that. We can work out how we can, okay?
Okay.
Yes, Mr. Fee. Are there any other
I
questions?
just lowered my hand. I did it wrong. I'm sorry.
No worries. Are there any other questions at all or comments today? Okay, well, thank you for everyone's time this evening, and I appreciate you guys taking the time out to do this. Please spread the word. Let people know we have our weekly calls. Again, feel free to reach out to myself or the Executive Council for any information or questions, and Mr. Dr. Briar Ash for questions regarding the clinic and COVID. Thank you for your time this evening, everyone, and I'll see you guys next week.
Thank you.
Thank you.